what the initial impact of artificial intelligence is going to have on healthcare, and where in healthcare we can have those that kind of technology be infused in responsible and ethical ways, so that it can actually bring forward some innovation and some needed change to the way we think about how patients access their healthcare services.
All right. So Inez has AI. She's interested in that. How about you, Martha? What do you see in 2024?
Yeah, it's interesting. I was just reading an article today that over the next 3 years, we're going to just see a boom in the transition to value-based care. So I'm super excited about that because organizations are really hesitant to dedicate too much of their budget right now to the tools and the technology that are needed to succeed in population health. So a lot of times when we're doing that work, we're kind of doing it off the side of our desk with people who also are involved in the operations of fee-for-service care delivery. So I was super excited to see, over the next 1 to 3 years, we are just going to see it explode. So those budgets will have to support what's needed to be able to be successful in value-based care.
The biggest thing leading us to value-based or blocking us to value-based?
The biggest thing blocking us to value-based care, and I know Ines will have thoughts about this as well, I think is that we're still operating in a majority fee-for-service world. And so we have to dedicate our operating budgets to that fee-for-service world, and we have to still think about increasing volume, but at the same time where we have about 30% of our revenue from value-based care, we still have to succeed there too. So, hospitals and health systems operate on a very, very thin margin. We hear about hospitals going out of business all the time. So they can't operate in two business models. So that is the biggest challenge right now to really going full-blown value-based care. Ines, I'm sure you have other thoughts.
I agree. I think it's all about the big picture. And right now, the way that the fee-for-service hospital health systems work is not about the big picture. It's still about profitability, revenue generation, differentiation, and marketing, and providing services that drive those main factors. And I think in order for us to go big and really be successful in value-based care, it really requires organizations to think more holistically about the social, the economic, the environmental factors that all influence health, and being a part of the solutions to those and in the communities that they serve for the population